Hello everyone, I'm Dr. Abhishek, Assistant Professor in Department of Radiation Oncology, Lady Hardinge Medical College. Today is World Cancer Day. So, we all know that cancer is most important public health concern nowadays, and incidence is on rising trend, and everywhere report more number of cases in comparison to the last year. So when we talk about cancer, it really scares us, but what is important to know about the sign and symptoms so that you can prevent it? And whenever you have such signs and symptoms, you can report to the hospital so that it can be diagnosed at earlier stage. So what you need to worry, if you find any change in the habits of bowel or bladder, you need to worry about it. You need to notice any kind of change, thickening, lump in any part of the body. If you find any difficulty in breathing, or you have the cough, which is persistent, if you have the sputum, if you have the blood in the sputum, so you need to worry about this thing. You need to get investigated. If you have the mole, if it is increasing in size, you need to worry. Any non-healing ulcer in any part of the body, you need to report to a doctor. These are the few of the most common symptoms. If you have any change in voice, then you need to report to a doctor, and you need to just confirm whether these are the signs related to cancer or it's something else. So other things which you can diagnose it early is a screening. So screening is available for few of the common cancers in India, like breast cancer. A standard recommendation is to go for mammography. And when you have to go for the mammography is advisable after the age of 50 years up to 74 years, and you need to do it every too early. So if you have anybody in the family who are diagnosed with breast cancer, then you need to modify your screening practices based on oncologist advice. Cervical cancer is the most important cancer among women. So for this, there are two tests, pap test and the HPV DNA estimation. Probably if you are more than 21 years of age, you need to go for the pap test. And if you cross 30, probably dual testing with HPV DNA and pap test every 5 years is the standard recommendation. Third is the oral cancer, which can be screened, and can be detected early with the use of oral visual examination. And another cancer which not in the priority of the government of India, but they're important, like when the smokers want to get screened for lung cancer, low dose CT scan is the standard of choice. Prostate cancer, it is although debatable and not advised by few of the guidelines, but still, you can go for PSA. This is prostate specific antigen estimation with the digital rectal examination. And the another cancer is colorectal cancer, which is screened by sigmoidoscopy, every 5 years, colonoscopy every 10 years, with few, stool based tests. So you need to just consult your doctor to get advised by the for the, appropriate screening test. But apart from screening, to know about the sign and symptoms of various cancers, and you need to just prevent it by adopting the healthy lifestyle, which includes, like, you need to have the healthy diet, you have to be physically active to prevent obesity. Smoking and alcohol are the two important factors which are responsible for many of the cancers. So you need to just prevent taking alcohol and smoking, which in different form is available. So apart from that, infection is one of the other causes for cancers, like hepatocellular carcinoma, cervical cancer, vaginal cancer, vulval cancer. Then a few of the viruses like Epstein Barr virus causes lymphoma, and one is Helicobacter pylori, which is causing gastric cancer. So you need to prevent this. And for the most important thing, like to prevent HPV virus infection, we have the vaccine available, which is called two, kind of vaccine is available. One is bivalent and other is quadrivalent. So based on the doctor advice, if you are in age group between 9 to 26, you need to get yourself vaccinated, because it prevents, like from cervical cancer, other another cancer which is caused by human papilloma virus. Second is the hepatitis V virus vaccine. So it is vaccine which you can take, and it can prevent you from hepatitis, virus induced hepatocellular carcinoma. These are important thing, and an oncologist has a very critical responsibility nowadays to make people more informed about various preventive strategy for cancer, and advise more number of people to go for a screening so that we can detect it early and we can treat it, and probably the mortality and morbidity related to you know treatment and cancer can be minimized. So this year theme is I am and I will. So probably everybody has to come together to do something meaningful as far as the cancer prevention and screening is concerned, because in a country like India, where we are called resource constrained, this will only drive the future of cancer outcome in the future.